All right. Good evening, everyone. How's everybody out there? I'm Dr. Sally with Regenex Pittsburgh. I'm going to be leading you guys through the webinar tonight. Thanks for tuning in and participating. If you joined us on the radio on KDKA radio last night, thank you for listening. If this is the first time that you're hearing about Regenex, welcome. And at the end, I'll open it up to some additional questions. So if you think of anything, feel free to ask me when we finish up the webinar. Let's go ahead and get started. So tonight I'm going to be talking to you about Regenex and how this is a trusted alternative for your typical orthopedic surgeries. So in this webinar, I'm going to show you, number one, our three-step process, where we get our cells and how we process cells. I'm going to talk to you about how these procedures work and what they can help. And I'm also going to answer your questions, like I said, at the end. So who am I? I am Dr. Jesse Sally. I received my undergraduate education and medical education from Virginia Tech, the Virginia College of Osteopathic Medicine. I did my primary specialty in physical medicine and rehab at UPMC, and then did my fellowship in musculoskeletal sports and spine medicine from UPMC as well. I'm an avid snowboarder and cyclist. These are my two partners, Dr. Lieber and Dr. Adelsheimer. Dr. Lieber in the middle, Dr. Adelsheimer on the left. We have actually now 3 locations around the Pittsburgh area: Pittsburgh, Bridgeville, and Washington. But our main office is in our Pittsburgh location in Fox Chapel area of Pittsburgh. We've been part of Regenex since 2012. We were actually the 6th clinic to sign on nationally, and now there are over 75 clinics throughout the country. We've done over a couple thousand stem cell procedures and over 10,000 PRP treatments over the course of our time. So basically, Regenex is a means of filling a gap in continuum of care that usually leads to surgery. So Regenex is trying to provide a solution for patients between pharmaceutical and therapies and steroid injections, or your typical PT chiropractic care and other conservative treatments, and providing another option before people move on to surgery. So what we know about orthopedic surgery, although I'll always say that there is definitely a case for orthopedic surgery for certain people, but a lot of the evidence behind orthopedic surgery is relatively poor. What we have seen is that in randomized controlled trials, surgery is actually not showing that much different outcome in terms of sham procedures or just not doing surgeries at all. A lot of them, over 50%, have been shown to be relatively ineffective in the clinical trials. So, but with these surgeries, a lot of it is more money, and it's more and the outcomes with it are very high risk in terms of complications. So there's a lot of surgeries that happen, for the shoulders, for the spine, for the knees, for the meniscus, and these are currently covered under your health plan. But the complications that come with that, obviously, as you can see, heart attack, stroke, nerve damage, infections, blood clots, and even death are relatively significant and do increase by over about 300% a lot of the times after these surgeries. So instead of having patients undergo these invasive treatments that may or may not be effective and come with a high complication rate, we're focusing more on letting the body actually heal itself. And the big topic of discussion is that surgical orthopedics may not be the dominant form of care in the 21st century. Like I said, with meniscus surgeries, 95% of the time, they're just removing that meniscus spacer. So they're actually taking out tissue that you need to provide shock absorption and rotational stability in the knee movement. Research now shows that removing that tissue actually just speeds up the onset of that arthritis becoming worse. So the idea is to stop cutting stuff out and instead utilize these biologic agents from your own body to help tissues actually heal. So what is Regenex? Regenex is a new form of what we consider interventional orthopedics. Interventional orthopedics is a less invasive new specialty that where orthobiologics, basically meaning the cells from your own body, are harvested and delivered by injections into the area where they are supposed to go. Obviously, a lower risk alternative to surgery. Now, within Regenex, as a practicing element of interventional orthopedics, this is a highly selective physician network. So there's very few physicians that qualify to be in the Regenex treatment system. And they harbor proprietary high dose protocols, and that comes from a lot of our harvesting techniques and our processing techniques that we use in our lab to give you the highest amount of cells possible for the best treatment possible. Regenex has also done a lot of the research and development within the orthobiologics world. So a high volume of the actual research that goes into PRP and stem cells comes from the Regenex conglomerate and the Regenex headquarters in Colorado. It's a self-funded employer practice. So everything in the Regenex system is used to go back into that research and development so that we can make these procedures better for you as patients. So interventional orthopedics is basically similar in idea to interventional cardiology. So we're transitioning from the knife or the scalpel to the needle. It used to be that to do an open heart surgery, it really required you opening up the chest and doing very invasive heart procedures. Now they can do a lot of cardiovascular surgeries through cameras and putting that up into the vessels in the heart. So that's interventional cardiology. Similarly, interventional orthopedics uses your own cells to reduce pain, and we're using very highly specialized guidance to be able to do that. And we can reduce the need for elective orthopedic surgeries by up to about 70%. We represent, like I said, a new medical specialty. As these biologics and delivery devices improve and our methodologies improve, we feel that most of those open orthopedic surgeries will be able to be replaced by precise needle-guided procedures. Our goal, again, is to use less invasive procedures to avoid more invasive surgeries. So this is the typical setup that you might see in an interventional orthopedics office. You can see the big C-shaped machine in the back. That's our what we call the fluoroscopy, which is the X-ray machine. That's what we use to visualize bones and joints for certain needle placements. And to the right of that, in front of the window, is an ultrasound machine, which we can use to guide needles in real time into joints and into soft tissues. And you can see with very high specificity, even higher than an MRI, what tears and damage structures look like under the skin. This is an example of what one of our labs look like, where we actually process the stem cells and process the blood platelets. So everything is done by hand in our offices. Nothing ever leaves the lab, and we don't utilize any third-party pharmaceuticals or other outside products in our mixtures when they go back into your body. Common areas treated. Basically, I usually tell patients that we treat everything from the top of the head to the base of the first toe. You know, everything from all your major joints, knees, hips, shoulders, all the way down the spine, and also even into smaller joints, hands, wrists, carpal tunnel, arthritis in the thumbs, arthritis in the big toe, all the tendons, ligaments, muscles, everything that you can think of that normally would be treated by your typical neighborhood orthopedic surgeon. So with these Regenex procedures, like I said, they're much more minimally invasive. So you're getting Band-Aids on the skin rather than sutures and large bandages in big areas that can possibly become infected. So that leads to faster recovery, less downtime, shorter rehabilitation. Usually our rehabilitation times are about a third of what you would normally experience after surgery. No additional, high-powered medications needed. You're back to work in a few days and not a few weeks. And most of the time you're awake through these procedures. There are a few procedures that we use a little more sedation, but most of the time patients tolerate this and don't have to be subjected to heavy anesthesia. So we can go through a few examples of how we execute some of these interventional orthopedic procedures. One big thing that we're doing now is actually healing and fixing, I guess, repairing ACL tears, a very common surgical procedure in athletes. And we're doing this under X-ray guidance because the ultrasound machine doesn't necessarily show as well into these deep tissue structures of the ACL. But using image guidance and precise needle placement, you can see that we can actually visualize the ACL bands, and we can actually inject and fix those ACL structures rather than opening up and reconstructing the whole thing. This is more of a precise needle guidance example of injecting into a shoulder and into a shoulder labrum, which requires a very precise needle placement. This is, a difficult area to access and a very precise area to access with a needle. You would otherwise have to open up the shoulder and fix this invasively to get a true labrum repair. But for a lot of athletes and even our everyday clientele, this is what we're doing to treat a lot of different shoulder injuries. This is a treatment of a knee where we're actually placing some of the stem cells into the bone, where the actual bone is starting to be damaged because of the arthritic change that's happening in the joint. This is a relatively newer technology, and this is actually utilizing the cells to heal the bone from the inside out. And the outcomes on this are showing, a 80% reduced need for a follow-up surgery, even at 15 years out from these procedures. So this is a very new and exciting technology that we're using in the clinic today. This is an example of us injecting the platelets and growth factors around the median nerve, which is the nerve that is affected in carpal tunnel syndrome. So people that have carpal tunnel issues, we're actually injecting these growth factors and cells around this nerve and what we call hydrodissecting it away from this overlying tunnel so that people can have alleviation of pain in the nerve and in the hand. This is a picture of what about a 5-month follow-up from a rotator cuff injection procedure. As you can see in the left-hand picture, this is a complete rotator cuff tear where there's actually fluid from the joint extending out into the superficial area above the rotator cuff. This is close to about a 1 centimeter full thickness tear with minimal retraction. As you can see here, after the Regenex procedure, the stem cell injection procedure, this is a well-healing rotator cuff tendon, no longer having that joint fluid extending out into these tissues out around the shoulder and escaping from this rotator cuff tear. And this is what a relatively normal appearing tendon would look like as it is healing. This is a patient that was actually from Pittsburgh that was treated for avascular necrosis in her knee. This is a little bit of an older picture, but you can see the difference after the stem cells were placed into the joint and into the area of decaying bone, that there's actually a new layer of surface bone that's forming over that area. And she went from needing crutches every single day and needing crutches with all of her activity to not using crutches and walking normally and living a very active and healthy lifestyle. So how does this regenerative medicine actually work? Well, we'll start with PRP. That's the platelet factors that come from the blood. So this is what we use the actual blood draws for. So PRP is platelets are your typical healing agent that float around in the blood, and in those platelets there's growth factors that help with amplifying healing. So you can almost think of PRP like espresso shots for local repair cells, and those local repair cells would pretty much be the stem cells. This makes them work harder and longer. So we always refer to PRP as almost like the miracle grow for stem cells. So how do stem cells work? Stem cells are kind of like your general contractor for the repair job. So they pretty much tell other cells what to do to repair damage, and they can turn into cells that reflect cartilage, tendon, bone, ligaments, and sort of all the tissues that make the musculoskeletal system work. They also use these same espresso shot growth factors, but the platelets contain those in higher quantities. You can basically use your own cells to turn into the bricks and mortar and replace the cells that were damaged. So stem cells are, when you cut your skin, the reason that it regrows into typical normal tissue is because those stem cells differentiate into those other types of cells. So it's your own cells. What can these cells do? What can they help? PRP basically comes from, we're going to talk about what PRP is in terms of a blood draw example. We're going to talk about stem cells in terms of how we extract those cells and how we implement those cells. We'll talk about the right medicine for the job, including what we need for concentration, how much of a dose we need to utilize, and we check on the viability of those cells so we know that the draw are active. 50% of what we actually use is probably PRP, and we'll also talk a little bit about what it can't help. So let's talk about which one is specifically for patients. So PRP typically is used more often to address smaller joints, so joints like in the hands and in the feet, less severe arthritis, so more mild to moderate arthritis, things like ligament tears, ligament instability, ligament damage, tendon tears, tendinitis, tendinopathy. And PRP is primarily what we use in the spine. I would say 99% of our spine cases typically involve PRP and blood platelets rather than stem cells. Stem cells are better for larger joints, things like your major joints, your knees, your shoulders, your hips. They're better for more damage. So even people that are in that category of severe arthritis or that quote unquote bone on bone arthritis that everybody talks about, that's where stem cells really shine in terms of helping people. And they're also good for injecting into the bone, which I said is a relatively new technology that we're using. About 70% of what we do is probably more PRP based, and about 30% is typically stem cells and PRP. There's a significant cost differential between those two, but not everyone needs stem cells. And we try to be very specific in our evaluations and in our discussions with patients about what we really feel will help you and what we think is going to be the best treatment for you. So what do we expect for a stem cell procedure? So there's 3 different treatments that go into a stem cell in a treatment overall. So there's 3 different days. So day 1 is going to be what we consider your pre-injection, or this is kind of the preparatory work that we use to till the soil in the joint in order to plant a garden with those stem cells. So we use some different injections into the joint and around the joint, something called prolotherapy, which actually helps to stimulate a small amount of inflammation in the joint and in the tissues around the joint to actually rally your body's immune response to the area. So this is like preparing that joint to accept those stem cells and make them more active. This doesn't create a lot of soreness in the joint. In fact, in a lot of cases, it actually helps to alleviate a lot of pain. But again, it heightens that immune response and it prepares the site to take full advantage of those stem cells once they're introduced. So day 2 actually comes with 2 separate parts. The first part of that day is going to be the stem cell harvest. So we're taking the stem cells out of the bone marrow. That's why they call it bone marrow concentrate. And that's going to be the source of where those stem cells come from. Those cells are going to be taken out of the backside of the pelvic bone. That's an overall minimally uncomfortable procedure. A lot of patients have this procedure done and they tell me after the fact, I'd say 9 out of 10 people get off at the table and they say that was nowhere near as bad as I thought it was going to be. So the discomfort with it is minimal, if any. Those cells, like I said, are taken out, they're concentrated on site, and they're re-injected back into the area of the damaged joint on the same day. And then you go home. The stem cell injections after we do that concentration, that's planting the seeds. So that's actually where we introduce those cells into the damaged tissue in the joint or wherever they're going to go. This is usually about 2 to 4 days after that first injection series. Like I said, we do the bone aspiration first. And then we do the lab processing, and then we do the re-injection usually later on that day or in that afternoon. So like I said, patients usually rate that bone marrow aspiration minimal in terms of pain or discomfort. The last day is usually, again, about 2 or 3 days after that stem cell injection. And this is where we're going to do a blood draw. We're going to process that blood that we take just like a typical sort of PCP lab draw. And we're going to concentrate down the platelets, and we're going to re-inject those platelets into the joint. And again, those platelets are like the espresso shots for the stem cells. So this is more like fertilizing those stem cells and continuing to kind of bolster that reaction that the stem cells are having within the joint, and enhancing that healing response in the area. Like I said, Regenexx has a high hand in a lot of the research that happens in the stem cell and orthobiologic world. Regenexx has the largest patient database in the nation right now. This is a patient registry that follows patients throughout the course of their procedure from start to finish. And then over the course of at least a year after their procedure, there are now well over 35,000 patients within that registry. Using that data, they've been able to publish about 29 peer-reviewed papers, which is a big deal in terms of research, in terms of enhancing the field and gathering that ongoing research and development that helps with making these procedures better. Again, the clinical research, we helped with developing the ACL repair system, and there's a lot of research that continues with rotator cuff tears and additional looks at knee arthritis, and the data that just came out on injecting those cells into the bone. So there's always new research that's coming out, and Regenexx has been a big part of leading that field, to be able to, again, see what's possible and see how we can make these treatments better for you. Regenexx also published the world's largest safety paper on stem cell injections and just procedures in general. This added to the body of evidence showing the safety of these procedures for orthopedic conditions. Basically, this paper looked at over 2,000 outcomes and showed, minimal, if any. The biggest, I guess, outcome in terms of patient problems was discomfort at the injection sites. So, minimal safety risks, if any, with these types of treatments. So we're using all of these things to stack the deck in your favor. You have the best doctors doing the most highly researched techniques, using the best imaging techniques to deliver these treatments as safely as possible. We've done the research on the implementation of these procedures and the safety of these procedures, and we know that we have a good prediction of what the outcomes are going to be, and we know that they're safe for people to undergo, even more elderly patients up to the age of 98. It's personalized, so this is tailored for you. So when you come into the clinic, we are going to do the treatment that's going to best serve your needs. So everybody is kind of their own snowflake in terms of how these procedures are executed. So everybody's treatment is a little bit different. We'll do the evaluation in the office. Typically, we try to spend anywhere from 45 minutes to an hour with each patient. We do imaging usually with each evaluation, and we do a full history and physical and thorough examination in order to determine your candidacy. We want to make sure that if we're going to do a treatment, that we feel it's going to be effective for what you have going on. If we feel like we can't be helpful, then we're going to let you know, and we'll kind of direct you in a way that we feel is going to best serve you. So we do look at different patients' candidacy, and if we feel like we can be helpful. We're very upfront with our transparency in terms of, like I said, how we feel we can be helpful and costs of the procedures. So who is this for? It's for people that want to avoid surgery. It's for people that want to keep all their parts and don't want to have things replaced with artificial joints or metal. It's people that don't have a lot of time for downtime and that can't be off of work and don't want to go through lengthy rehab or don't feel that they can tolerate that. So if you want to get back on your feet quickly, this is the way to go. People that don't want to be on the long-term drugs or high dose opioids. We try to avoid that, and most people are able to get off of any medications that they're on as a result of the recovery that they have. People that have had failed surgeries before, or people that have had one knee replaced and been through that, and they don't want to go through another one, and they want a different option. These are a lot of people that we see in our clinic, or people that are too young for surgery. We have had people that come in that have early onset arthritis that are not looking forward to have surgery at a young age, or that don't want to do it and then have to do it again later on once that needs replaced again. The results with it, we're looking at good outcomes. We want to get people in less pain. We want to improve people's function. And as a result of having less pain and better activity, it's overall improved mood. So people feel better, they act better, they move better, and they're able to interact with their families and their life better. They get off of pain medication, they get off of long-term anti-inflammatories, and get back to, moving without pain and feeling better. And then back to that preferred and active lifestyle. And no matter what level of activity that is, whether it's somebody that's an athlete or somebody that just likes to garden and just wants to be with their family and enjoy time with their grandkids, that's typically what we see. So what would the next steps be for you in terms of seeing how we can help? Most people do not need a referral. If you can call our office and make an appointment with us to come and spend some time and talk. If you have prior imaging, MRIs or X-rays, bring them. If you do not, that's okay. We can order things if we need to, but we can also do some imaging, like I said, on site with the ultrasound. Our Regenx liaison will walk you through getting set up with an appointment. If you're a candidate, we'll talk about what kind of treatment we can do. You'll get your rehab after the treatment, and you'll get back to your life as soon as we possibly can. So making an appointment, again, we are local doctors. We were all from the Pittsburgh area originally. We've all lived here most of our lives, except for going away for medical school and some education purposes. But we've all come back and planted roots here. We're specialty trained in our specific fields with executing these procedures in a very high functioning manner. And like I said, we have the imaging to help with to make these treatments as good as we possibly can for you, but we can also get imaging to help with guiding these treatments a little bit better as well. Like I said, we spend about an hour talking with each person and doing an examination. We like to look at all of the things that could contribute to a person's pain, whether that's stability in a joint or how the nerves are affecting the joint. And maybe people are having issues with their back that are causing pain, down the chain. We look at how things on the other side of the body affect problems on the painful side. So we're looking at the whole person rather than just at a specific area. And like I said, little to no downtime, minimal rehab, no pain medicine, minimal missed time at work and with life, and you're back up and moving sooner than later. You want to avoid, reasons to get back a hold of your health today. You don't want to avoid surgery backlog. A lot of people were just okay with saying, well, I'm going to live with this for as long as I can, or I'm going to try to walk on this knee until I can't walk anymore. But you don't have to do that. You don't have to hold off a surgery. You don't have to suffer with this. There are options that we can put in place to help you get better and to help you get back to activity. People want to get their fitness under control. They want to get their weight down. I've even had people who say, they want me to lose weight before I have this surgery, and I just can't because I can't move very well. And that's a person that we can probably help. You want to be able to increase your quality time with loved ones and the people you care about. And really, at the end of the day, no one's getting any younger. So you want to make sure that you're, getting ahead of this curve with, getting ahead of your treatment and trying to maintain as much activity as you can. So some of the financial information, insurance does not cover the regenerative procedures themselves. So those three elements of treatment that I talked about, the prolotherapy, the platelet-rich plasma treatment, and the platelet or the stem cell treatments, are not covered by insurance. But insurance does cover any consultations that you have with us in the office, any follow-ups that you have with us in the office, your bracing and your therapy, and any additional diagnostic, studies or anything that we need to order. So it costs, it's covered by your insurance to come in and talk to us and at least find out what your options are. And a lot of times in certain insurances, with copays that you might have and with deductibles and with, ongoing copays for rehab and all of these other things, your actual payment for a traditional orthopedic surgery would maybe end up being higher than what you would actually pay out of pocket for these procedures. So, it is worth looking at how much you'll actually end up spending, or how much you may have already spent in managing these pain symptoms up to this point. And again, we're putting together customized treatment plans for people that come at a very wide range of pricing. So it's really impossible for us to know what a procedure is going to cost before we, actually look at somebody and determine candidacy and determine what we would want to do. So the next steps for most people are just really scheduling a new patient exam. Come into the office, see us, talk to us, let us answer your questions if I haven't already with this. And we can tailor a program specifically to your needs. So contact Sarah at our office, 412-963-6480, and you can schedule an in-house or a telemedicine consultation, and we can get you on the way to getting better. So at this point, what I'll do is I'm going to open up the floor for questions. So if anybody has any burning questions that they'd like answered, I'll do my best to field everything as we go along here. Take a look here. So I don't see any questions floating in just yet, but I'll give you guys a minute if you do want to share anything. Does anybody have any questions? Here we go. If you've had a knee replacement, can you still treat that knee? In a lot of cases, there have been patients that we've seen come in that most of the time, if they've had a knee replacement, they're looking to have treatment for the other knee. Now, with knee replacements, most of the time after you've had surgery, it's difficult to do any more injections into that joint, and really it's hard to treat that because the joint is already a false joint, really. So, but there are people that still have pain after knee replacement surgeries, and sometimes that pain is not necessarily related to the replacement itself. So sometimes people will have pain symptoms that linger in tendons or in muscles or in ligaments that support the joint that aren't necessarily related to that replacement. So there have been patients that I've treated in the past who have had surgeries, and the surgeries themselves have been relatively successful, but they still have pain. And there have been some treatment options that we've been able to put in place to get people at least some reductions in their pain after surgeries. How long does it take before you can get an appointment? I mean, if you call tonight, we'll give you guys a call back tomorrow, and we'll get you on the schedule and get you into the office as soon as we can. I mean, you're not looking at weeks really to get an appointment. We'd be able to get you in relatively quickly. So, we're scheduling people ASAP, really. Next question, can you compare the timeline for recovery for knee replacement to recovery from a knee regenerative procedure? Yeah. The timeline on recovery is usually, like I said, the rehabilitation process for a regenerative procedure is usually about a third of what it would be for a knee replacement. So you're looking at about, in terms of true downtime, your weight bearing restrictions on the treatments that we do are 1 or 2 days, and that's it. And then after that, you're up and moving around again. So you're not looking at tremendous amounts of recovery. But it can take a couple weeks for pain relief to kind of start to settle in. But again, it's much faster and much easier than your recovery after a knee replacement. Next question, how long does PRP last in your knees? There's varying time frames. Usually it's years, depending on the patient and depending on what we're treating. There are variables to that. I would say the best data that you can look at on that is on our website. It actually tracks out people's recovery from PRP for the knees over several years, and you can see how that looks for people in terms of how long it lasts and how long that pain relief is good for. But I would say you're not looking at doing these every couple months or something like that. We're looking at years rather than months. The next question, how many stem cells do you inject? How do you count them? We have a cell counter in the laboratory. It's you're looking at injecting upwards of, we range average anywhere from 800 million to 1.5 billion. And usually it's on the higher end of that scale, with the processes that we use to access these cells and process them. We're getting very high concentrations of stem cells when we do inject them. These are really good questions, guys. Next question, let's see here. Do you do this procedure in all your offices? That's a good question, and the answer is no. The procedures are done in our main office, our headquarters, which is in the Fox Chapel location. We do see consults in Bridgeville, and I also see follow-ups in Washington. So those offices are usually more for follow-ups and certain procedures that we can do. But the regenerative procedures are done in our Fox Chapel office because that's where our lab is located. Next question, will this work on bulging discs in your neck? Yes, we do cervical procedures a lot. So there are a lot of treatments that we do for the cervical spine. Like I said, we do treatments for the low back, for the mid back, for the neck. We do lots of cervical treatments for sure. Again, like I said, great questions. You guys are killing it with these questions. So anybody else? One more here. Does diabetes impact this procedure? That's a good question. The answer is relatively. People that are uncontrolled diabetics, fragile diabetics, people that have A1C levels that are well above 6, nearing 7 or above that. Really what we look at is a person's healing capacity. So controlled diabetics usually will do well with this procedure. People that have more out of control diabetes, it's not something that will tell people they can't have the procedure, but it definitely does affect people's ability to heal appropriately. The next question is, what do stem cells do in the joint? That's a very loaded question, but I mean, stem cells act to actually heal and protect the surface tissue of the joint. If we're injecting into the bone, they actually help to heal the bone from the inside out. They help with restructuring meniscus tissue. They help with healing ligament structures like the ACL. So there's a lot of different things that stem cells do in the joint. So it would just depend on what we're doing and how we're executing these procedures. Can you do more than one site at a time? With the stem cells, no. We try to do one single major joint at a time. The reason for that is when we utilize or when we do these stem cell draws, it's always a varying amount of cells that we'll get, or a varying volume of cells that we can use for these procedures. So you don't want to perform a draw and basically be under treating two bigger joints. We try to focus the concentration on one site at a time, and that makes not only the procedure better, but it also makes your recovery easier, and it makes the outcomes better. Now, we do look at people that have repeat procedures, and we take that into account when we're scheduling the follow-up procedures. So we do recognize that as you kind of go along with different treatments. But there are times, and I will say this, there are times when we've been doing stem cell procedures. Like if I do stem cell procedures for the knee, in a lot of instances, if there is a bad knee and then the other knee is painful, but it's not as bad or not as painful as the other affected knee, I have been able to do stem cell treatments for that knee and then platelet treatments for the other knee. And I've been having very good outcomes with that for patients. Or doing maybe stem cell treatments for a knee and doing additional platelet treatments in a shoulder if there's some minor issues that are happening there. So it does depend on what kind of problems and processes we're dealing with. But in those instances, yes, I have been able to treat more than one site at a time. So it does depend on what kind of cells we are using. But that's a great question. And you are welcome. Again, great questions, guys. If anybody else has anything, I'm more than happy to answer it. But I appreciate you guys tuning in. Like I said, the best way to get a lot of the questions answered and for us to really know what we're dealing with is to make an appointment and come in and see us. It's not a loss to you at all. And I feel like in a lot of cases, we're figuring out good ways that we can treat people's problems, and getting people back to a pain-free life. So if there's any other questions, throw them out there. It doesn't seem like it though. So thank you guys again for tuning in. I appreciate the attention. Oh wait, maybe we got one more here. One more. What kind of tool do you use to harvest the stem cells? So a lot of this information is also online. So, if you wanted to go online and look up a lot of these detailed questions, that's fine. We actually use a very small gauge drill needle to actually get into the bone. It's a lot quicker, a lot less painful, and a lot more efficient than using those old kind of trocars that people would think about whenever they were talking about harvesting. So that actually really does minimize the time. It minimizes the discomfort for the patient, and it helps to make our cell draws a lot more efficient. So it's a very, very, very good technique for doing these types of procedures and keeping the pain to a bare minimum. Good question. All right, guys. Well, again, thank you for tuning in. I really appreciate it. I appreciate your time tonight. Like I said, come in and make an appointment, talk to us. If you have any other questions, check out the website. There's a lot of great information on there, regenxpittsburgh.com. You can also fill out a candidacy form on there and send your information in that way. We really appreciate seeing you guys and hoping that we can help out. Have a good night, and have a happy Thanksgiving and a happy holidays if we don't hear from you. Good night. Thanks.